so now you've had rhinoplasty and you've been given instructions and a bottle to rinse out your nose, but you're staring at it and you have no idea what to do. Hi, I'm Dr. Sarah Saxon. I'm a board certified facial plastic surgeon. And in this video, I'll be showing you how to properly use a NeilMed sinus rinse bottle, which is good to clean out your nose after rhinoplasty surgery. I prefer the NeilMed sinus rinse bottle over the neti pot, even though they come from the same company. I like it because you can aim it a little better in your nose. If you're like me, I have something called patchless eustachian tubes. So the eustachian tube is the tube that goes in the back of your nose all the way to your ears. So for me, that's always kind of open, especially if I'm dehydrated. So if I were to just put this in my nose and squirt really hard, water would just go straight into my ear, which is not comfortable. So with this bottle, you can aim it either towards your septum or directly to the back or towards the side, depending on what your goals are. All of those are advantageous. So I start with the bottle here. It has a line, a dotted line at the top that is the fill line. So you take the top off. These can be cleaned in the dishwasher. So once you've used it a couple times, it's a good idea to really keep it nice and clean because you are putting liquid in your sinuses. Always use distilled water, never tap water. Distilled water takes out all the bacteria and pollutants in the water. Even though tap water is safe to drink, it's not safe to put in your sinuses because of the bacteria. It can cause a sinus infection. So I take some distilled water and fill the bottle all the way to the top, to the fill line. Here we go. You see it's all the way to the fill line. Technically you can use it at this temperature, at room temperature. However, your body is warmer than room temperature, so it will feel cold in your nose and not feel comfortable. So what I like to do is put it in the microwave for about 20 seconds. In the box, you'll find some salt packets like this. And if you run out, they come in a separate box too. They usually come in a box of about 100, so they last a long time. These packets are really important because it brings salt into the water, which your body has salt in it. So that was really quick here, so now it'll be a lot more comfortable. It also, the salt packets here create a pH balance solution for your nose. So very important you put these packets in here. So you just tear off the end and then pour the packet into the bottle. And then screw on the top. I give it a little shake just to mix it up. Now the first time you do this after surgery will be difficult because you'll have dry blood and mucus in your nose. It will not be fun, but as the week progresses, if you keep doing this a couple times a day, it'll get easier and easier. And the goal is for the liquid from the bottle to go in one side of your nose and out the other because there's a connection in the back. You will be somewhat swollen afterwards, and so it might not ever happen in that first week. But the more you can clean out the nose, the better you'll feel, the better you'll be able to breathe after surgery. I don't put any splints or packing in the nose after rhinoplasty. Some surgeons do, so it will be more difficult to do this in that case. However, for my patients, since there's no packing or splints on the inside, you should eventually be able to get the liquid through. So for a demonstration, so I like to lean over a sink here. It can be a little messy. I have a towel on the ready. So lean over the sink and then situate the bottle inside your nostril and then gently squeeze. And then the other side, do the same thing. And then Keep doing that until the bottle is completely empty. You probably won't have a nose as clean as mine on the inside because I do these rinses all the time. These are even good to do once you've healed from surgery because the nose on the inside will be somewhat dry. And so you'll get dry crusts and things on the inside. So really that whole first year after surgery, doing this periodically will help. If you have a time of year that maybe your allergies are a little bit worse, that's a good time to do it too. But always be sure if you're using it in combination with nasal mists or medications to do the rinse first and then follow up with the medications, because otherwise you'll rinse out those medications and they won't be as effective. Again, I'm Dr. Sarah Saxon, double board certified facial plastic and reconstructive surgeon in Austin and Dallas. If you want more information about my practice, go to saxonmd.com. You can also find me on Instagram at SaxonMD or call our office at 512-537-4191. Thanks, guys.